was the last time your organization solved a problem that another department accidentally created? When was the last time? As healthcare leaders, we don't wake up trying to make things harder for patients. That would mean we're making it harder for ourselves. We are trying to help. So, why does helping sometimes become complicated? So, as you may know, or if you haven't, I've spent years working in healthcare. And as a fellow nurse, I've seen extraordinary physicians, dedicated nurses, outstanding therapists, incredible case managers, and exceptional administrators that go above and beyond. And yet, patients still wait, discharges are delayed, equipment arrives late, appointments are missed, authorizations stall, departments become frustrated, not because people don't care, but because systems don't communicate. We feel great departments, but great departments don't automatically become a great healthcare system. So what do we do? What do we do? Healthcare isn't broken because people don't care. It's strained because everyone is solving only the part they can see. The physician is focused on treatment. The nurse is focused on care. The case manager is focused on discharge. The DME company is focused on equipment. The transportation provider is focused on the ride. The pharmacy is focused on the medication. Every department is doing its job. But who is responsible for connecting them all? That's the question. Then I began to ask a different question. What if we stopped building better departments and started building better ecosystems? Because healthy organizations perform better. Communication improves, patients benefit. It's communication. When coordination improves, providers benefit. Less stress. When operations improve, communities benefit. Let's discuss the MOC philosophy. At MOC Divisions, we've learned something. The greatest opportunities in healthcare aren't always clinical. Remember, everyone is a person. Sometimes they're operational. Sometimes the biggest breakthrough isn't a new medication. It's getting the right patient to the right place with the right equipment at the right time. Operational excellence is patient care. My favorite, the biblical foundation. My faith has shaped how I view leadership now. In 1 Corinthians 12, Paul describes the body with many parts. I cannot say to the hand, I don't need you. And the hand cannot say to the foot, do not need you. Each part has a purpose. Each part depends on the others. I believe organizations work the same way. Every department values the others and works together. The entire body becomes stronger. Healthy organizations perform better. So now I'd like to challenge the leaders. Here's my challenge to every executive leader. Ready? I want you to ask yourself 3 questions this week. Where are patients experiencing unnecessary friction? Which departments rarely sit at the same table? What partnership could strengthen our ecosystem? Sometimes the solution isn't another department. Called communication. And with communication, there comes is connecting the ones that they already have. No new departments need to be created. Thank you so much for listening. I am Temi Shalito. I really appreciate you for joining me for our first talk. And today's conversation challenged the way you think about organizational health. I love for you to continue the conversation with us because I believe healthy organizations perform better. Until next, I'll see you.